Hey everyone,
Hello, I'm Dr. Krista Burris,
I'm Dr. Michael Kim.
and we're here on August 25th, 2021, for today's update about Coachella Valley situation as far as it pertains to COVID. And we're from the Coachella Valley Direct Primary Care.
Well, how are you doing today?
I'm doing good. I'm doing good. We're getting to the end of summer, which is hard to believe that we're sort of starting a new school year and sort of mentally shifting to fall, and the holidays are coming up, and I'm like, I'm not, can't quite wrap my head around that at this
Yeah,
point.
we have 2 out of 3 kids started school, and the other one's starting tomorrow. So
Yeah.
that whole shift in schedule will start again.
And that's going to be part of what we talk about today as well, because we're starting to see a lot of kids coming home from school with notices that they got exposed or with symptoms and they've been sent home. And a lot of people are wondering, well, what do I do in this situation? So we're going to actually talk about that a little bit, about some of the real life situations that we've seen come up multiple times.
All right. So you want to
So,
start with the numbers?
yeah, sure.
All right.
So today, this is our District 4 weekly report. So this is for the Coachella Valley. And what you'll see here is that for this week, the Coachella Valley had about 947 cases. So this is a significant increase. It's more than twice as many as we had in the past couple weeks. So we also have seen an increase in deaths. I These numbers lag a bit. I know of more cases and more deaths of this within the last week.
Yeah.
So I think that unfortunately we are seeing the effect of Delta here in the valley. And you'll see that there under the hospitalizations, how we've had a significant increase in our hospitalizations. They've popped up over 100. And I don't know if you recall, we were back down in the 12 range before Delta hit us. And along with our ICU numbers, they were in the like 0, 1, 2, and now we're running around 14, which again is representative of data from last week. This week, these numbers are actually almost twice this.
Right. And I think people need to remember this is not 14 beds in the ICU, and the ICU has 30 beds, and so these are 14 beds with people with COVID, not counting the other ventilated patients from an MI or stroke or trauma, right? So in order to have 14 beds taken up by just one disease, that's significant.
Yes, it is. And the other thing that's sort of unique to COVID patients, well, not the only patients like this, but they tend to take a long time in the ICU. There are other conditions where people may be in the ICU just for a couple of days and improve and sort of move out. With COVID, if their patients are severe enough to need the ICU, they tend to be there for several weeks. If they survive, it takes a long time for them to get out. And that means that those beds are sort of taken up for a long period of time. Whereas normally, even a patient with an open heart surgery or so might only be in the ICU for 2 or 3 days.
Yeah,
absolutely. So it's a little bit of a stressful scenario when you're trying to plan how to take care of all these patients when you see your ICU numbers doubling for COVID every week, right. Because we can add plenty of vents. We have all the equipment we need, but what we don't have is a huge amount of well-trained ICU staff. And an ICU bed that's trained, that's, if you're being cared for by a trained ICU staff, that has a limited number of patients, you're going to get like great care. If you take that same staff and you double the number of patients, they're going to try to give you good care, but they're just going to be stretched thin. But then when you stretch beyond that, what happens is you take staff that have less ICU experience or just recently been sort of initiated into the ICU for the surge. And while they may be good at their jobs, normally they're working in a high stress situation outside of their usual job description. And so that is a scenario that's less ideal.
Right. And then usually in an ICU, you might have one renal patient, one heart attack, one stroke, and there's nurses going back and forth. But with COVID, you don't want that. Right?
No.
These nurses aren't floating. So now with the COVID patients, you're limiting the patients the nurse can take, because if they have one COVID patient, they probably can't just go to all their other patients. So.
No, yes. So it's that's really the struggle when we talk about the strain on our hospital systems. It's not really just about physical space and we're out of beds. It's really we're out of staff. So that's in basically the other parts of the country are just soaking up all the nurses that normally travel. And hospitals usually rely on these type of staffings to help during periods where things are bumping up. So that just means there's less for us to pull on because they're all getting pulled to the south.
Sorry, that was a rabbit hole.
Okay, rabbit hole, yes. Okay, next slide. Sorry, everyone. So this is our daily update here, and what you'll see is that Riverside County has started producing countywide numbers every day, and just done our weekly ones for the Coachella Valley, which is great. This is fine. But this gives us a little faster feedback about what's happening in the county, and we see that we're having a fairly brisk number of cases, but we're not exponentially increasing. Like our case rate per 100,000 is basically flat. And so this is really good news. I'm hoping that what this means is that we've kind of hit the peak of what we're going to do with Delta. I hope. And that positivity rate is actually lower than it's been in a few days. So I'm encouraged. I hope this isn't just a fluke. I hope this is true, that we really plateaued. The big caveat to this is going to be what happens with the school kids, because they've just returned to school and we're starting to see just like large numbers of kids testing positive and being sent home under quarantine. So we'll see if that changes the trajectory here.
Right. And then in October, we start hitting our snowbird season, so we'll increase our population. So I would imagine we'll see a little bump in that as well.
We'll see. Usually when the snowbirds return is when we also get influenza coming back into the valley. So we'll see what happens this year. Next slide. So this again is a daily epidemiology report from the county. This is countywide, and you'll see our new cases for the last 24 hours of 1,143. So that's again about double where we used to be. And unfortunately, we are also seeing some new deaths. And if you look at the graph at the very top left, it looks like it goes sharply down. The reason is because this is a graph of when the cases started when they do the contact tracing and they call people and they talk to them and they find out when they had their first symptoms. So there's about a week's lag in them counting those cases. And that's why it looks like there's a huge decrease. So you can kind of ignore the last thought. But if you look before that, it does look like we've probably plateaued at this point. And so I'm hopeful that over the next 2 to 3 weeks, we don't see it go back up. I know they can't see me pointing, but I can. Okay. Go ahead and go down. Oh, yes. Okay. So this is what I meant by we're seeing an improvement in our positivity rate. So over the 16, 17, 18, we've seen it trending downward. This is really good. So fingers crossed this keeps going and we don't have another bump up.
Even though our little plateau is going up still.
Yeah, I mean the graph, if you look at that yellow line, it stops under 10. So it basically would go up past 10 to 11, but it looks like at this point we've kind of hit that plateau. Okay, so Dr. Kim, we've had a lot of people call us and talk about, what if, well, I've had this situation or I just found out. I mean, we have a lot of these conversations with our patients and also friends. And so I thought maybe we'd talk about some of the most common ones that are coming up so that people can sort of apply it to their own situation if they need to.
Right. So maybe I thought the first thing we can do is just go over some basic things that we know right now. Like, okay, so we know we have the Delta variant, which is more sticky, meaning that if you come in contact to it, you're going to not be able to get rid of it as quickly because it's like Gorilla Glue, right? And we know that the vaccine has been proven to be very effective at not preventing serious illness in most people.
And preventing illness.
Right.
So the county actually got a report from Riverside Public Health Department about this, and what it looked like was vaccinated people were 120 times less likely to be hospitalized, right, but then 37 times less likely to actually even get COVID.
Right.
So it does protect you against disease, but it's not 100%.
Right. So we know that even if you're vaccinated, you can still catch the disease. You can still spread the disease. But we do know the vast majority of people that are being hospitalized are the unvaccinated. But doesn't mean they're all. Right? There are some vaccinated people
Mm-hmm.
on the vent and all that. So, and then we know that social distancing, whether you're vaccinated or unvaccinated, does help. We go back to that Swiss cheese model, and every layer you can put in is going to help you stay away from the possibility of getting COVID. Nothing is 100%. You can do everything and still get it. That's just the reality of this disease, right? So those are kind of the foundational things, right, that we start with.
Yeah.
So let's start with the slide deck.
So what do I do if? So this little presentation, it's not long, is help when you are faced with a complicated COVID situation.
Right. So the first one is someone who called me and said, okay, then if you want to move to the next slide. Yep. So they had an employee and the employee is vaccinated and the owner is vaccinated, and they had a situation where they needed to go take care of a sick family member who actually has COVID. And so, the questions were, what do I do about when the employee comes back? Do I test him? Do I not? How do I make sure that everyone's safe and they're safe? So what are your thoughts, Dr. Burris?
Well, what I did is I went to the actual CDC's website and got their recommendations. And their recommendations here really haven't changed much There was a little bit extra added when vaccines came out. So now we have sort of two tiers. What happens if you're a vaccinated person and what happens if you're not vaccinated? So in this case, we're going to talk about what happens if you're a vaccinated person. And if we go to the next slide, we'll see what they say. Oh, that's not quite right. There's got to be a slide before that. That one. Yes. So what happens is that worker who went home to take care of a sick person, if they're fully vaccinated, which means 2 weeks after their second shot, they can be around other people. They need to wear a mask, but they can still go to work. They can still go to the grocery store. And the recommendation is that they be tested somewhere in the 3 to 5 days after their last exposure. So calculating last exposure is a little complicated because if you're caring for a sick person with COVID, I would assume you're being exposed around them. So technically, that person is considered contagious for 10 days, or if they're still having fevers, for even longer. So it depends on how long that person's sick relative has been sick. So once the sick relative is out of their isolation, that starts the clock for their caregiver. So they now have another 2 weeks after that where they need to be alert and watching for development of symptoms. And they need to be really careful wearing masks. And they need to be tested 3 to 5 days after that last day where their loved one was considered contagious. So does that make sense?
No, it does. And so I'm going to challenge that a little because I'm a practical guy. Right?
Okay.
So let's say this person goes and is taking care of their relative for 6-7 days. It is very hard to wear your mask, wash your hands, do everything possible so that you, even though you're vaccinated, you're not exposing yourself to COVID. So I would say if that's a situation, for me, I probably would want them to say, okay, 5 days after you've taken care of your relative, don't come to work. 3 to 5 days, we'll test you. And if you're not symptomatic and you're test negative, we'll bring you back to work. Still watch for symptoms for 14 days. But I know myself, I know people, and it's very hard to do, right? This is ideally, right? These are ideal conditions. You wore the mask 24/7. Right?
No, this is assuming you were actually exposed. So we can talk about whether or not this is wise. Your approach, I think, is safer and better. But the official CDC recommendations don't require it. They do require you to wear a mask whenever you're around other people. But they don't require you to stay home.
Oh, so they're saying if you're with that person, doesn't matter. You don't need to wear a mask. It's after you've stopped taking care of them, you need to wear a mask when you're going outside.
Technically, they are not differentiating between the two exposures. However, we're getting into the weeds.
Okay.
But I agree with you.
Anyway.
They're different exposures.
Okay.
But
we'll continue.
Yes.
So.
Okay.
So the bottom line, what would you tell this person?
The bottom line is I would say if you could stay home from work, do it, especially for that first 5 days. If you can't, make sure you're wearing a mask. And then try not to attend social events and be in large groups of people. Just be aware that you are potentially going to catch this in the next few days, and so you want to protect other people. Okay. So this is another thing that's starting to happen quite a bit. I'm just going to use an example of a child named Esther. This is not a real person, but this is a real example. So Esther comes home from first grade, and she has a runny nose and a sore throat, and the school sent her home. And The parents take her in, get her tested, and it comes back positive. Her parents feel fine. They're completely healthy. They have no underlying medical conditions. They have no symptoms, but they're unvaccinated. Do both parents really need to stay home from work, or can one of them stay home and take care of Esther and maybe the other one go to work? And if they don't have any symptoms at all, do they really need to quarantine? And can they just get a vaccine like the next day and then go back to work? So these are questions that people have because, this is going to be a major impact on their family. So on the next slide, we're going to answer these questions. So this qualifies now as our unvaccinated close contact. So these are people who've had that contact with a loved one with COVID, but they're not vaccinated. So if you have not completed full vaccination, that means 2 weeks after your second shot, you're in this category. So even if you just had your second shot the day before, you're still considered technically unprotected. So if this is you and you have contact with a person who is contagious, you've got to quarantine for 10 days. You can be tested at day 7 with a PCR, ideally. And if that's negative, come out of quarantine early. But let's talk about what quarantine actually means, because I feel like people, no one's checking on you. No one's coming to your door to make sure you're doing this. It's all on the honor system. And it can be very tempting to kind of fudge it. And so let's talk about what quarantine is and why healthy people have to quarantine.
Okay, so I guess quarantining means you want to make sure that you prevent yourself during your most contagious time frame from passing on to other people.
Are people actually contagious before they have symptoms?
Yes.
That's interesting. Is it just with COVID or other viruses like that too?
There are other viruses that do.
Oh, is that right?
Yeah.
Yes. So actually, people are most contagious for viral illness before they're sick.
Yeah.
And I think people don't know that, and it doesn't make sense to them why I have to stay away from people if I'm not sick. It's because we don't know who's going to actually get sick. So if you've been exposed, you're at risk to get sick and spread the disease before you know you're sick.
Right. And with the other variant, at least the first one, they were saying up to 2 days before, right? It's kind of average. Is even if, let's say you're actually symptomatic, well, 2 days before that, you were spreading the disease around.
No, it's the same with Delta.
Yeah.
It's 2 days before somebody gets sick. Everyone that you've been in contact with is potentially now infected. And it may be another 5 to 7 days before they start to develop symptoms.
Right.
And during that period of time, they're also spreading it.
Right.
So this is why we quarantine people who are healthy and we isolate people who are sick. And the length of time of quarantine has to do with the incubation period of whatever illness we're talking about. So in this case, COVID's incubation time is between 5 and 10 days. Although there are outliers, most people will have developed symptoms by day 7 to 10. So that's why we quarantine for 10, sort of as a practical matter. And we say, if your PCR is negative at day 7, that's pretty good that you're probably not going to actually come down with it, and we'll let you out in the community. So quarantine means you don't have contact with people outside your home. And so that means you don't throw a party at your home. You don't go to the store. It's a pain in the rear end, basically, if people do it right. But if people do it right, you then stop the transmission of that virus in its tracks, and it doesn't keep going.
Okay. And you want to go over, well, what does what does exposure mean? I mean,
Yeah. So, clearly if you're living with someone with COVID, you've been exposed. But for a lot of us, we may have been find out somebody at work or at school technically has COVID, and you wonder if you're considered a close contact. Do I have to quarantine or not? Or do I have to be tested? Close contact is defined as 15 minutes less than 6 feet away from that other person. So technically, if a child in your kid's class had COVID and they were on the other side of the room and your child never came within 6 feet of them during their contagious period, technically your child would not be a contact. However, it becomes very difficult if people are at work or at school to know everyone who had contact with each other the entire day. So for safety's sake, we tend to identify people who are at the highest risk, say the person who sits right next to that person. But everyone else who was in the same room for a prolonged period of time would be considered a contact.
Well, those are the only two slides.
I don't know. Let me see what I got. Do I have anything else? I think that might be it.
Okay.
Oh, here we go. This is the last scenario. What if Esther was just exposed to another child at school and has to stay home in quarantine, but she doesn't have any symptoms? So does Esther's family also have to quarantine if their child was exposed? The answer is no. No, they do not. But they should act with some discretion, knowing that potentially they have a member of their family who may develop COVID in the next few days. This is not a good time, again, to go to the movies or to go to a large party. This is a time for everyone to kind of hunker down and minimize your exposure to the community until Esther's out of quarantine. If there are high-risk people in the home, like say maybe a grandparent or someone with underlying health conditions, as much as possible, you should separate that person from the quarantined person. Even though that person's not technically sick yet, they could be in that early phase where they're becoming contagious. So you want to sort of shelter the high-risk person from that potentially contagious person.
See, I would have been depends, right? So if Esther is 16, Esther goes in her own room, Esther doesn't come out, you provide everything, Esther has a nice 10 days in her room, right? If Esther's 5, then one parent has to practically say, I'm going to quarantine with Esther. Because you can't do the back and forth, because now then you're spreading the risk to both parents. And if both are going to work back and forth, practicality wise on a public health level, not so good. So, I would say, and then it also depends on are the parents vaccinated or unvaccinated, because that also plays into the role of it all. So it gets a little complicated.
It does. And honestly, it's not realistic that parents are going to have a sick child and not get exposed to them.
Right.
Even that 16-year-old, not all 16-year-olds are the same. We
Right.
have one kid that we could throw in the room and the other kid that one of us would have to go in there. So it depends also on the temperament of your child.
And living situation.
Yeah. And some people don't have the ability to actually isolate within their home. And then if that is the case, I would say at the very minimum, do not let the people sleep in the same room, a high-risk person and the potentially contagious person. At least have them sleeping in different areas, minimize a bit of their exposure.
So the ticker in the bottom is reminding us that
we gotta go.
We have another show. So if you can join us on the next show, we're going to be talking about more about your personal health as it relates to here in the Valley, but we wanted to take a little bit longer today and kind of go over some of the nuanced stuff because it is a little complicated and trying to figure it out. Delta is here. We're testing. We're getting a lot of positives. It is like we said, a stickier virus. So people who have been able to avoid it aren't avoiding it anymore, especially if you're unvaccinated. If you come in contact, there's a good chance you'll probably get it, and there's a good chance you'll be okay. But then there's also a good chance you're going to spread it to someone else. So be careful out there. If you haven't been vaccinated, you can still get vaccinated. It's not too late. And we just want the school year to go well.
Yes, I didn't answer that question. If you haven't been vaccinated and you have a close contact, can you just go out the next day and get vaccinated? You actually can, but you would still need to quarantine because you won't be protected until 2 weeks after that second dose.
Right. So that's what, 2 weeks? It's a month, right?
You're 6 weeks, really.
Yeah, 6 weeks.
Yeah.
So, all right, everyone. Thank you for joining us. I'm Dr. Kim.
I'm Dr. Burris.
And we'll catch you next week. And hopefully it'll be a dull week with, boring numbers.
I'm all for boring. Yeah.